Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
And with us now in the studio is Dr. Thomas Vento from the Mercy Medical Center. Doctor, good to see you.
Thank you. Good to be here.
So spring has sprung, and we had an unbelievable amount of pollen, and then fortunately we've had some nice rain.
Well, unfortunately, the rain hasn't done much for the pollen. It can suppress it a little bit, but even on these real heavy rain days, you can still have quite a bit of pollen in the air.
I was thinking that the next few days, when it dries out, everything's growing like crazy.
Yeah. It'll probably be even worse, especially as soon as it dries out, everybody will be out cutting the grass, and things will start blooming all over again.
So what do you see in your practice this time of year? You have people coming in saying, I know I have allergies, I need some better drugs, or are there other symptoms that are sort of downstream from that, like a sinus infection or something? The person doesn't really know they have an allergy problem.
Yeah, a lot of times, and this year in particular has been pretty tough on allergy sufferers. People who never knew they had allergies before will come in, and oftentimes they'll say, I've been sick for weeks, and then all of a sudden I got a fever, chills, and it turns out to be an infection at that point. Allergies will never cause a fever. The early on symptoms are the runny nose, the congestion, the sore throat, and if people haven't had allergies before, they don't recognize it as such. So,
and then there's some people out there who have no idea what we're talking about because they aren't allergic to anything.
Right, exactly. God bless them, because I'm not like that. So, yeah.
Hay fever?
I get a little bit of everything. Allergies year-round.
Yeah.
So.
My thing's always been hay fever, and the trick has been finding a medication that won't knock you out. Because when I was a kid, they had this great antihistamine that worked, but you fell asleep.
Yeah.
And then they came out with the newer drugs, which had less of the drowsiness, but also seemed to me less of the effectiveness.
Right.
What do you like?
Yeah, you're absolutely right. There's a couple of different medications on the market, and actually 2 of them are over the counter right now, the Zyrtec or cetirizine, and then there's the Claritin or loratadine. Claritin is not as, and I always mention the brand name, but I always recommend buying generic. Same exact medicine, just half the price. But the Claritin doesn't seem to be as effective as the Zyrtec. The trouble with Zyrtec is you have to take it at night, because it is the one that does cause you to be drowsy.
And these are now 24-hour pills as opposed to the old 4-hour.
Right. Yeah, the 4-hour, 6 hours, like the Benadryl. I usually don't recommend taking Benadryl unless you develop things like hives. Those will typically make you pretty drowsy and knock you out.
Anything that, as you mentioned, over-the-counter stuff, is there anything with prescription that you like?
Well, prescription-wise, the only antihistamine still available oral is Allegra. And that comes in a generic form, the fexofenadine, and that's pretty good, too. But if you can get the generic Zyrtec cheaper over the counter, I recommend doing that.
All right. Let me remind our viewers, if you have an allergy question, you can give us a call right now. We'll have the number on the screen, or you can email us by visiting our website at mpt.org. So there's some other things. I mean, people get watery eyes, hives in some cases. What do you do for that?
Well, depending on the majority of their symptoms, I usually treat according to that. If somebody comes in and says, the only symptoms I get are just the itchy, runny, watery eyes, I'll give them a prescription antihistamine eye drop. If they can tolerate just doing some artificial tears over the counter, that's fine, but most of the time they'll need an antihistamine eye drop, which is basically like taking a pill but dropping it directly in the eyes.
What happens as we get older? Do some people develop allergies later in life, or in some cases do they sort of burn out?
I think for most people the allergies seem to burn out, but in midlife it seems that some people start developing newer allergies, and I think it's just they hadn't been exposed to certain allergens in the past. Maybe they moved from the West Coast to here, and now are being exposed to completely different things.
What do you think about allergy testing? Has that changed since I was a kid?
Well, we do, sometimes in the office I'll do a blood test, a simple blood test for patients, to give them a general idea of what they might be allergic to. But it's not as specific as what your allergist can do. And I do recommend seeing allergists and getting the allergy testing done if your symptoms aren't controlled with medication.
Let's take a phone call. This is Victoria in Baltimore County. Victoria, thank you for calling. Go ahead. Hello, Victoria.
Hi.
You're on.
Okay.
What's your question, ma'am?
Okay, I'm just wondering if a baby is having allergy symptoms. Is there something? Hello?
Yes, you're on. And the baby's having allergy symptoms.
How old is the baby? Well, I'll tell you, if the baby's over 6 months, I always recommend talking to your family physician first before giving a child anything. Make sure it is allergies. But anybody over 6 months, and my children both have had allergies, can actually get the generic Zyrtec, the cetirizine. It's a lower dose, and you always want to clear it with your physician first.
Do you think there's anything to the alternative stuff? I don't even know what's in the universe for that, the acupuncture, the different herbal remedies.
You know, I think acupuncture's been around for thousands of years. It's got to be some truth to it if you go to the right person. As far as herbal remedies and stuff like that, I mean, I think it's really, you want to block histamine is what you want to do. And so I think going with the pills is the way to go.
Yeah, and there's also, depending what you do for a living, the option of trying to stay indoors as much as possible.
Yeah, exactly. And, a lot of people, though, have the dust allergies. And so those are going to be year-round, whether you're inside or outside. So there's sometimes no way of avoiding them.
Okay, so bottom line advice is that there are some good medications. You don't have to rely solely on Kleenex.
Exactly. And if you start developing symptoms, take the medication, because if you let it get too long, you're going to end up in my office.
Are some of these things the type of drugs that the old pill, you took it, it worked in 20 minutes? Mm-hmm. Are some of these things the type that you got to take it for a few days before you see anything?
You'll notice a difference within the first day of treatment, but I recommend taking it routinely. Continue to take it every night, especially during the peak allergy season.
Okay, and of the over-the-counter stuff, the Claritin's probably the less effective of the two in your view?
Yeah, but, I would always reach for the Zyrtec, but take it at night because it does make you drowsy.
All right, Dr. Thomas Vento with the Mercy Medical Center. Thanks for being with us.
Thank you.
We appreciate it.